Got ethics? This is the National Board Dental Examination Part 2 review for the ethics section. So, why do I need to study for the ethics questions on Part 2 of the National Boards? Well, because it's just good test-taking strategies. These questions are not difficult, and you should get 100% of them correct. This is your chance to score easy points. The ethics questions are in this section, Patient Management. You will also note that these subject areas that form the basis of the National Board Part 2 come from the ADA website. And if you look in the National Board Dental Examination Part 2 guide, you will notice in the explanation of the content and exam preparation materials exam questions, of which there are 500 total. If you look specifically at the patient management section, the number of questions are approximately, or at least, 12 out of 51 questions in the patient management section. These are the ones related to ethics. Again, they are not difficult. You should get all of them correct. This is your chance to score easy points. Don't leave easy points on the table. Be prepared. Keep organized and on task. Make a schedule so that you know exactly how much to study and when. Of course. So, what do I need to study for the ethics questions? Well, if you will recall, all of these questions come from the patient management area, and the ADA ethics resources are the basis for these questions. That means the material to study is the Principles of Ethics and Code of Professional Conduct found on the American Dental Association website. Now, we need to figure out where we are going to study for our ethics section of the National Board Part 2. Again, make several copies of the Principles of Ethics and the Code of Professional Conduct, and then place them in several areas around your living situation, and open each to a different ethics principle. That's right, several copies. And put them around your home in different places, have them open to different sections, and be ready to study these questions at any particular time. You have to remember, it's only a 23-page document. There are only 13 pages of actual code, and they are divided up into sections, basically a study outline format already. The Principles of Ethics, Code of Professional Conduct, and the Advisory Opinions. As you will recall from your ethics course in the first year, there are 5 fundamental principles that form the foundation of the ADA code. The code then gives you the expression of the types of conduct that are required or prohibited or even expected, and then the advisory opinions are interpretations that apply to the Code of Professional Conduct. So starting with Principle 1, Patient Autonomy, as you recall, self-governance. It includes patient involvement, informing the patient of the proposed treatment, as well as patient records. Dentists are obligated to safeguard the confidentiality of patient records. The advisory opinions give you further thoughts or comments on what is expected conduct-wise for the principle of autonomy. Principle 2, non-maleficence, do no harm. The dentist has a duty to refrain from harming the patient. The Code of Professional Conduct for Principle 2 goes into the details of education, the duty to consult and refer. Principle 3 is beneficence, to do good. The dentist has a duty to promote the patient's welfare. The Code of Professional Conduct for Principle 3, beneficence, talks about community service, government of the profession, and research and development, information or comments on patents and copyrights, and finally, abuse and neglect. Principle 4, justice or fairness. The dentist has a duty to treat people fairly. Code of Professional Conduct for Principle 4 talks about dentists and patient selection, provision of emergency services, justifiable criticism, reviewing and commenting on the treatment of other professionals, other doctors. The Code of Professional Conduct also discusses expert testimony and rebates and split fees. Finally, Principle 5, veracity or truthfulness. The dentist has a duty to communicate truthfully. The Code of Professional Conduct for Principle 5 discusses representation of care, representation of fees, disclosures of conflicts of interest, the use or recommendation of devices and therapeutic methods, the drafting and use and publication of professional announcements, advertising, how a dentist presents their name or the name of their practice, the announcement of specialization and limitation of a dental practice, So, this is the review for the National Board Part 2 Ethics section. It's not difficult. It's more about just getting into the material, having it available to you, studying it, and knowing the vocabulary as well as the concepts in each principle. Good luck!